Okay, good morning, good afternoon, everyone. My name is Irfan Patel. Today, I'm honored to welcome you all on behalf of NORD, National Organization of Rare Disease, in my capacity as the ambassador for Delaware Rare Action Network to our Rare Disease Day 2022 virtual program. First and foremost, I'm a patient, a caregiver, and an advocate, and an advocate for the rare disease community. Like many of the panelists here today, I'm wearing multiple hats. As we all know, the last day in February is recognized as the Rare Disease Day across the globe. As we say in our rare disease community, alone we are rare, together we are strong. Leading up to today's event, a series of programs have already taken place in support of Rare Disease Day. This year, we did have a virtual celebration on the 28th of February organized by NORD at the national level. And before that, on January 20th, Representative Paul Bombach introduced House Concurrent Resolution 47, recognizing February 28, 2022 as Rare Disease Day in Delaware. And the resolution was jointly sponsored by Senator Nicole Poore, Senator Brian Townsend, Rep. Krista Griffith, and Rep. Jeffrey Spiegelman. So the whole idea behind these RDD events is to raise awareness on this cause. It's about building synergy across the globe, whether it's the lighting of a bridge in Brisbane, Australia, in support of Rare Disease Day, or the lighting of Ben Franklin Bridge here in Philly. It's all about connecting this community together. For special needs families, as if the challenges are not enough, the unknowns add to the already compounded set of challenges. And in some cases, it's very extreme. Many of you have heard me share my family's story in the past in various forums, the diagnosis of two of my kids with methylmalonic acidemia, MMA, and their subsequent secondary diagnosis. Just when we thought we had nailed everything down, life keeps throwing curveballs at us, right? Just this past year, my daughter had multiple episodes of acute pancreatitis that required multiple hospital stays. And her older kid has had multiple bouts of mental health challenges and issues. I guess everyone now is going through mental health issues due to the added stress of pandemic and other not so pleasant developments around the world. But for the special needs community, it all multiplies and adds up. And you will hear from other patients and caregivers on their journey today. And one of the objectives of these rare disease awareness campaigns, and specifically of the RAN network, is to foster that framework so we can advocate for supportive programs. As we have seen in the past, expansion of the newborn screening program is a prime example. MMA was not part of the newborn screening in the state of Delaware when my kids were born, and hence we missed it. But now those two conditions are added to the newborn screening. So there is a lot of synergy in working together. And again, in our last year's event, we had initiated the idea of starting a RDAC, right, the Rare Disease Advocacy Council in our state, and we hope to hear from a Lieutenant Governor more on the topic. Today, we have a distinguished set of speakers amongst us who will be sharing their views and perspectives on this topic. As you see, we have a right mix of both lawmakers, as well as patients and caregivers and other supporting organizations. We are all excited to hear from our own Lieutenant Governor Bethany Holland, an ardent supporter of RDD, Rare Disease Day, and special needs community in our state, Senator Nicole Poore, Senator Rep. Paul Bombach, all great supporters and champions for this cause, and also looking forward to hearing from our patients and caregivers who will share their rare disease journey with us. Before we move on to the next segment, a few housekeeping reminders. Today's program is being hosted as a webinar, as some of you have seen that invite. So only the speakers and the panelists are on the live Zoom event, and the rest of the audience are watching this as a webinar. So if anyone in the audience has a question or comment, please post them on the chat, and we will be monitoring the chat space. With that, I would like to hand it off to Kristen Angel, the Associate Director of Advocacy at NORD, who will be sharing the state report card for Delaware with us. With that, Kristen, please take it away.
Good morning. Apologies, I couldn't get off mute. Thank you everybody for joining us today for Delaware's Rare Disease Day event. My name is Kristen Angel. I'm the Associate Director of Advocacy here at NORD. And I'm going to share a little bit about some of the policy initiatives that we work on with our volunteer state ambassadors such as Irfan. And I'd also first like to take a moment and just thank Irfan for his hard work, dedication, and commitment to the rare community and all he does for the rare community in Delaware and beyond. He's just a wonderful ambassador, and we are very lucky to have him working with us. And thank you, Irfan, for all of your hard work for putting together today's event and all the other events that you've done and are planning to do moving forward. So thank you. NORD's state policy report card. We just published the 7th edition of our policy state report card. What we do is analyze all 50 states and Washington, D.C. on 8 policy issues that impact the rare disease community. Each state has their own individual report card. The issues we address in the report card are Medicaid, financial eligibility, medical nutrition, newborn screening, prescription drug out-of-pocket costs, protecting patients in state Medicaid programs, protecting patients in state regulated insurance, step therapy, or fail first as it's sometimes referred to, telehealth, and rare disease advisory councils. And up on this, if you can go to the next slide, I have a screenshot of Delaware's report card. And anybody interested in diving into this and taking a look at the issues and how the grading rubric was created can visit rarediseases.org, and I will actually put the link directly to the report card in the chat once I'm done. So you can reference it and take a look. It dives much deeper into this and gives you the grading rubrics as well. But this is just a snapshot of Delaware's report card. And obviously there's always room for improvement, and some of the ways that rare disease patients are impacted by many challenges and a lot of common challenges, and some of these issues many rare disease patients face within their states while living with a rare disease or caring for somebody with a rare disease. So we work with advocates in the states to help advocate to get these grades up or to continue keeping them where they are. In comparison to other states, Delaware is doing fairly well. So congratulations on that. There are some states that have very bad grades that reflect my high school days. So, it's a good thing, but there's definitely room for an improvement. And one of the areas that I'm going to talk a little bit about today is NORD rolled out last year in 2021 Project ARDAC. ARDAC stands for Rare Disease Advisory Council. And what that means is a Rare Disease Advisory Council is a advisory body that is a platform for the rare disease community to have a stronger voice within state government. RDACs address the needs of rare disease patients and their families by giving stakeholders an opportunity to make recommendations to the state leaders on critical issues that directly impact them and their loved ones, for increased awareness, diagnostic tools, access to affordable treatments and care. And I will also share a link to Project ARDAC's webpage as well in the chat function. But I do have a very brief video that gives a high-level overview of what an ARDAC is. So Irfan, if you can stop sharing your screen momentarily, and I will share mine.
Yep.
Okay. What is a Rare Disease Advisory Council, or RDAC? There are over 25 million Americans living with one of the more than 7,000 unique rare diseases. Even though an estimated 1 in 10 Americans have a rare disease, state policymakers often have limited awareness of the impact that rare diseases have on patients, their caregivers, and the overall healthcare system. Bridging that awareness gap means there's a need to create a standing advisory council in each state made up of members from the rare disease community to help educate legislators and state policymakers about how best to serve rare disease patients in their state. Rare Disease Advisory Councils, or RDACs, are the solution. An RDAC is an advisory body that gives the rare disease community a stronger voice in state government. RDACs address the needs of the rare disease community by providing stakeholders an opportunity to make formal recommendations to state leaders about the most critical issues they face. To date, there are more than 20 RDACs. NORD started Project ARDAC with the ambitious goal of establishing a successful RDAC in every state and to help optimize the RDACs that already exist. To help foster successful RDACs at every step along the way, NORD has developed a series of resources. Want to get involved? Contact us.
Great. And once again, I will put the links to the website links into the chat momentarily. And I just have one more announcement, I guess I should say, for Delaware Rare Action Network. You know, Irfan is leading the efforts in the state, but it's imperative to be able to make progress with the work we're doing, both on the advocacy level and the awareness level, that we involve additional volunteers to get involved with the Delaware Rare Action Network and NORD. So I encourage you, if you are not currently a member of the Delaware Rare Action Network, to visit rareaction.org and sign up today. It's a brief form you fill out and you'll get kept in the loop. You can also contact Irfan directly if you are interested in getting more involved. Obviously, one of the initiatives that we'd like to see getting worked on is a Rare Disease Advisory Council here in Delaware, but it will take a village, as the saying goes. So we encourage everybody to use your voice and your story to help advocate for change, help us with awareness events and activities throughout the year. We have some really exciting projects coming up through the Rare Action Network program in Delaware, and I know Irfan will be very pleased to have some additional volunteers on hand to help him out. So I encourage you to get more involved, and thank you for joining us today. And I'm going to pass the mic back over to Irfan.
Thank you, Kristen. Thank you very much. So let me share my screen back here. So. Okay, can you see my screen now? Okay, great. Now, I would like to welcome our Lieutenant Governor, Whitney Holland. We are so fortunate in our state of Delaware that a person of the caliber of Lieutenant Governor Holland has taken up the mantle of Lieutenant Governorship, right? She is a trained nurse, health scientist, and an university professor who is widely recognized for her tireless efforts in championing the cause of special needs community, including the mental health challenges. So maybe you should start referring to her as a doctor, right? Dr. Lieutenant Governor Whitney Holland. So again, it goes without saying, she has been an ardent supporter of rare disease community. And in fact, she was one of the first ones to introduce the RDD resolution back in 2013 as the then state senator. So as we say in Delaware, she has always been, and she will continue to be a strong voice for all of Delaware. So with that, Lieutenant Governor Whitney Holland.
Thank you. Well, it is exciting to always join you, and I look forward to this day every year where we can raise awareness. But I first want to start and say, thank you to you, Mr. Patel and Kristen, for your ardent support, both nationally and here in our state. And it's awesome to be joined with my incredible colleague from the Delaware Senate, Senator Poore, and also Representative Baumbach, who I know have also championed issues in rare disease, and each has their own personal experience. And I know our senator has some very unique lived experience, which I, as a nurse, just so value when I'm fortunate to be with colleagues who role model daily living with and uplifting our families, our children who have special needs. And so rare disease obviously is something that, Irfan, you and your family have done an incredible job in the state, uplifting others. And to the families who are here today, we very much value your support and your advocacy. As was mentioned, there are lots of opportunities, and many of you probably think, well, I'm so busy taking care of my child, my family, my parent, my loved one who has a rare disease. How do I have time? I want to share with you those letters, the calls, the advocacy that you do is so incredible. And you probably weren't expecting me to start with that. You probably thought, okay, she's going to talk as a nurse and a professor in epidemiology and give me some facts, right? And I'll give you some facts in a moment, but I first want to share the real value that you and families play in helping us craft change in our communities, in our states, and in our country. And it starts with your stories, your letters. Mr. Patel came to me, as was mentioned, as a nurse and a senator, and brought to my attention the real struggles. And I know for Senators Poore, Representative Baumbach, they feel it as well. We feel in you the challenges you face, not only challenges in transportation, challenges in housing often, but those challenges in getting medications, getting those appropriate treatments, being taken seriously. And so to those of you who might have one of 7,000 rare diseases among the 25 to 30 million Americans, of which 90% of treatments are not always accessible or available, it takes your language, it takes your stories, and it takes your momentum. And so never think that phone call, that letter, that email hasn't mattered. And so I was thrilled to join today. And, Kristen at the national organization took a little bit of the conversation that I was going to have, talking about looking perhaps here in Delaware at creating a NORD advisory committee or council where we can elevate and take into consideration those levels of care that we need to be addressing to shed light, to recognize what challenges you have. And I know during the past 2 years during COVID, it has just been even more difficult. I know as a person who's been fortunate to spend most of her extra hours vaccinating our most vulnerable, you in the community really had to wait for your loved ones. You and your community have unique experiences, not only during COVID. And so we genuinely do care and we do recognize the importance of the early diagnoses. And so champion changes in our newborn screening all the way across the spectrum. And as we look at that scoreboard, you are among some very competitive folks, our senator, our representative. We really do want to change those grades. We want to move some of those lower level D's and F's and C's up to A's and B's. And how we do that is collectively working together, you and the community, helping to strengthen everyday Delawareans and knowing that together we can be a stronger, healthier state. I'm one to be very conscientious of time. I know your webinar got started a few minutes late, so I have probably condensed a little bit of my remarks so that you can get to what I think is the most important component, and that is hearing from our elected officials as well. The most important, hearing from our patient and lived experience with family. Again, I have enjoyed every moment working with NORD. I feel very strongly that those of us who have experience with families who have unique challenges get it. And I'm so thrilled that you're working with the Delaware legislators for those who perhaps haven't had that lived experience. And so thank you for what you're doing. So the bottom line, let's continue to be advocates. Every little thing that you do matters. And perhaps in the near future, we can elevate a grade a little higher by perhaps having a council or addressing some of those other scorecard items that we need to change. So with that, I just want to say a full thank you. I am also chairing some national associations and I bring forward NORD everywhere I go. And so thank you to the community. You matter, we value you. And I'll put a note in chat where I will be mentioning, do not ever hesitate to contact my office. And I'm sure my other colleagues feel the same way. We're always here for you. There isn't a call, a question that isn't important. So thank you. And Irfan, I'm going to turn this back to you so that we can hear from others who have lived experience and our legislators. So thank you so much.
Thank you, Lieutenant Governor. Thank you for your inspiring words and as always, your willingness to help us, right? So definitely, I will be in touch with you, right, and your staff. Yeah, thank you very much. Okay, so with that, as part of the agenda, we're supposed to go to our next panelist, which is Jackie, and I don't see her on. I know she was having some difficulty getting on the panelist link here. So I don't know, Kristen, do you see anyone waiting to be let in or?
She is saying in chat that she is here.
Oh yeah, I see that chat. Yeah, so maybe she joined as the participant. Let me see.
Yep.
Give me 1 second. I see if I can add her as a panelist.
Yeah, that would be great. Yeah.
This was happened as presiding over the Senate. I've learned very quickly how to see messages and waves.
Yeah.
We learn how to read each other's nonverbal, right?
Yeah, that's true. Yeah, this is a new reality, right? New virtual reality now for us. Oh, she's here. Okay, great. Thanks, Kristen.
Nope.
Hey, Jackie. Good morning. Good afternoon. Very timely.
Hi, good afternoon. Thank you for having me. Sorry, I was a little technically challenged. I couldn't find my way in, but thank you for helping with the technology today.
Yeah, no problem. So I think we are right on the agenda where you're getting on the platform here. So let me briefly introduce you, right? So that way, or the audience know who you are. I think most of the panelists know who you are. So Jackie is a native of Delaware and has spent time working domestically and abroad, gaining various experience in how to get things done, reinforced by her master's degree in management. Currently, she is employed by a large financial institution here in Delaware. She volunteers as a coach for Special Olympics, right? And has volunteered with various organizations. Special Olympics is very special for me as well, right? She's also a mother of 4 adult children, ranging from 33 to 29 years of age, all of whom have a disability or a chronic illness. Jackie's unique blended family spans 24 years of needing a diverse background of medical professionals. Across her 4 grown children, she has 2 sons on the autism spectrum, which she also manages to their underlying conditions of binge eating, depression, anxiety, mood disorder, obsessive compulsive disorder, assistive technology needs, behavioral analysis, and speech and language pathologies. Jackie has a 29-year-old son with Crohn's disease who started showing symptoms at the very young age of 18 months old. She has forged a path for other parents, creating her own support groups and working with AA DuPont Children's Hospital to support other families who did not know where to turn for their children facing this chronic illness. As a matter of fact, that's how I met Jackie about 15 years ago as part of the Parent Advisory Council at AA DuPont. Jackie has held a large fundraisers for the Crohn's and Colitis Foundation and spearheaded the first 5K walk in Delaware. Her daughter is completely deaf in one ear. This was a particular dilemma as she did not qualify for covered services in the deaf community. Once again, Jackie used her background in forging uncharted paths to obtain services for her daughter into adulthood. Her daughter is now a peer support professional using her sign language skills to support individuals with IDD in the state of Delaware. Jackie continues to actively advocate for her children and others like them and the professionals that support them. So I really needed to look down and read my notes because she has such extensive background in this space. Thank you, Jackie. Thank you for taking the time to share your experience with us.
Irfan, it's always a pleasure. Thank you. And I want to thank Norid for having me here today and our distinguished guests here today. I'm going to try to set a timer so that I don't go over my time limit because I am known to do that occasionally. So if you've ever been on a platform where I've spoken and they're giving me time, okay, I'll try. So I had to go back to my 21-year-old self and say, how did I get here? How did I become a caregiver? Because I saw my name on the agenda and it said caregiver. And I went, but I'm a mom. And I had to go back. And my 21-year-old self remembers when my daughter was projectile vomiting and my first experience with anything really major in my life. And I go to the doctors and they said, oh, it's just a little spit up. She'll be fine. Your first time, mommy. And, I knew it wasn't right. And, long story short, the day that she threw barium, she projectile vomited across the doctor's room with barium all down the back of his doctor's coat. He turned his back and she did with precision, military precision down the back of his jacket. And I have to tell you, it was my proudest moment as a parent because she was sick and no one was listening to me. Long story short, she had underdeveloped stomach muscles and we got that taken care of. And then we fast forward a little bit and I got a phone call from a school nurse that says, how dare you? You didn't tell us your daughter was deaf. And I went, been trying to tell doctors that she was hard of hearing, but no one would listen to me. And so finally we get her to an institute and be darned if I wasn't right because, I could say ice cream in her left ear and she would ignore me. And I'd say ice cream in the right ear. We were going to get ice cream. I don't know what type of medical tool that is, but it worked for this mom. And I can tell you, then we found out she was completely deaf in one ear and the journey began. There wasn't a lot of supports. So proactively, no one could give me an answer to why she was deaf. And again, I didn't realize at this point I was a caregiver. At this point, I was just a mom. And I think I'm going to make t-shirts that say I'm just a mom. But at this point, I'm advocating for her. And I didn't know that I was doing this. I was, again, my 21-year-old self and where we are today. So we get there and we finally, we get a diagnosis, but we know she's deaf, but we don't know why. So I'm like, okay, well, I'm going to teach you sign language, because if you ever lose hearing in the other ear, I want you to know what to do. So she's far better at signing than I am. And I'm very proud that she takes those skills out into the community and uses those skills to work with individuals with developmental disabilities today. Sadly, what I will plug, because the Lieutenant Governor's listening, is she makes under minimum wage. And as an individual with those skills, she needs to make a living wage, and she has 2 children of her own. And I won't stay on that platform because we could stay there forever, right? So, but in the meantime, her brother was born, and and at about 18 months, he started having bowel problems. And at that point, again, I'm going back to the doctors. I'm saying, something's wrong with my son. You need to help me. Again, oh, you're first time mommy. You're okay. No, I'm not a first time mommy, but there's really something wrong here. And no one was listening. And so finally, he was getting really sick. I'm going to say this, and I'm going to try to say this with all the composure that I could muster. My son was dying. And I carried my son's, I carried him into the hospital commander's office. I was Department of Justice at the time. And I worked for the government, and I carried him into the hospital commander's office in my arms. And I basically said, the only way you're getting me out of here is if you have me arrested or you admit my son. We spent 2 weeks in that hospital. We were airlifted into another hospital. I was told he would always be a loose bowel child, just to ignore it. And he'd grow out of it by the age of 5 or 6. 5 came along. I was going through a divorce. I moved back home to Delaware, and the bottom of his little life fell out. And the pediatrician said, oh, it's because of the divorce. And I'm like, no, this is more than that. This is not that. And we ended up at AI DuPont Hospital. Thank goodness, because finally they diagnosed him with Crohn's disease. The journey began, right? And under the umbrella of AI DuPont Hospital, we had a host of doctors. We had a rheumatologist, we had a dietitian, we had a GI doctor, we had a dermatologist. The subset illnesses that come with Crohn's disease are lengthy and many. And it's how I did meet Ifran. And we forged together on the Parent Advisory Council, and I became a contact for other moms who would get this type of information in the middle of the night. I get a phone call from a nurse that had my cell phone number, that had free reign to call me and say, can you come sit with the mom and hold her hand? And I'd say, yes, I can, because I knew what it felt like to be alone. Crohn's and Colitis Foundation for Delaware, we weren't even attached to we were Philadelphia, Delaware Valley, but it really wasn't known here. People didn't know about Crohn's disease. The first time somebody handed me a full quart enema and said I had to give this to my little 5-year-old, it was awful. And this transition that we went through, we spent 10 years of our life living at AI DuPont Hospital. I remember the day they released us and said, okay, you're going to go into the adult world. I felt lost. I actually was afraid to leave. This was my family. This was his family. It's where we went when we needed help, when he was sick. So I didn't expect to feel that way, but I did. And again, I'm going to be honest with you, I still wasn't a caregiver. I still didn't realize I was a caregiver. It didn't hit me. I was just being a mom, living life, taking care of my kids, working a full-time job, and managed to fit college in there somewhere. But with this child came a whole host of things, and still trying to get services over here to keep my daughter going with her hearing needs, and finding out that she didn't fit in the deaf community and the resources just weren't there. So I had to go through insurance companies. We all know how that works. That's a full-time job in and of itself. So I joined the Parent Advisory Council. I helped other parents. In the meantime, I married a man with 2 boys, and one was severely autistic, and the other was diagnosed at the time with ADHD. But something about that said, That doesn't feel right. So I spent the next 10 years trying to find someone to properly diagnose him, and he was not diagnosed with autism until he was 21. So now my world expanded from a child who was deaf in one ear, a son with Crohn's disease, severe Crohn's disease. And now I have 2 boys on the autism spectrum. And I had to advocate for their needs. And as I transitioned each one of these children into the adult world, while I understand the law says they're adults at 18, let me tell you, when they have those type of medical needs, they need you there. I don't know what we're doing here in our state to attract and attain medical professionals, but boy, we need to do a better job at that. Because when Joshua needed to go to an adult GI, it was difficult to find someone that accepted, and Ifran, we were talking about patient-centered care 15 years ago, and we're still talking about patient-centered care today and teamwork, because I would go with my 18-year-old son to a doctor's appointment because he felt comfortable with mom still there, right? But the doctors didn't always appreciate that. And I'd get him settled, I'd roll off, he would come home and say, Mom, they're not listening to me. And so I'd go back, and that always wasn't well received. And then we finally found a GI doctor that was really good at it. And so I was thankful for that, but that took time. And even now, he'll be 30 in May, and he called me the other day. He said, Mom, can you help me out here? He says, because they're trying to charge me $5,000 for a medicine that used to cost me $5,000. He says, how did you make that happen? How did you do that? I said, well, these are the words that you need to say, son. He says, okay, Mom, thank you. And it worked. And and so they still know Mom is the one that fixes it. My 3 lovely grandchildren, the 2 older ones, know that Gigi's the fixer. That's what they call me, Gigi, and I'm the fixer. Can you fix it? So now I get to do the fun things. But then as I've worked with my 2 boys on the spectrum, that has been a huge challenge. Assistive technology, speech and language pathologists, behavior analysts. People really, sometimes they don't want to hear you. And I guess that's when the reality of I'm really a caregiver, and I'm going to be a caregiver for the rest of my life. That's not going away. My oldest son will soon be 34, and my youngest will soon be 30. They were gifted to me. Their mother passed away when she was 34 years old. So I've been raising them since they were little boys. And I'm blessed to have had them come into my life because I couldn't have any more children, and I wanted 6. So I got 4. And so you work with what you have. But I have to say that the transition at 21, especially for my boys on the spectrum, those services they drop right off the edge of a cliff. And it is a constant battle trying to get those services. And, I have a great employer, but let's face it, when both parents work full time and you're trying to get somebody to a speech and language pathologist appointment, a BA appointment, and it's all outside of the home, it's not contained somewhere where you can go to one center and get the services you need without somebody saying, oh no, that's an institution. I don't care how forgiving or caring or understanding your employer is, that becomes taxing, and you carry that. And then I'm going to add a few more things in here. And Ifran, I'm trying to stick to time. Then I became a caregiver to my husband. He had cancer twice. And in the span of from 2012 to 2017. So then you become a caregiver to a spouse. It's been a long road. It's been many journeys. It's been hard at times. And each of my children bring very unique personalities to the table. And I'm blessed and grateful for each of them and for the things that they have taught me, because I can tell you, they taught me more than anything I've ever learned in a classroom. I've joked that I have a medical background in a little bit of everything. But as they age, I can't express the importance of proper care in our state. When my son Alex was 18, he had his first seizure. I couldn't get a doctor here in our state to separate autism and epilepsy. And they gave him so many medications that he wasn't capable of making through his day. So we had to leave this state and go to another state to find a doctor who was willing to say, yes, I'm just going to look at epilepsy. And thanks to his efforts, we were able to get him under control, and he hasn't had a seizure since 2011. But we shouldn't have to do that here. We should be attaining and attracting our specialists here in our state. And I'm very, very blessed that we have AI DuPont and CHOP's not that far away. But again, the stressors of caregivers. I don't think I really, until Ifran asked me to join today, I don't really think I gave it some thought. If I could go back and tell my 21-year-old self as a first-time parent where I'd be today, I'm not sure I would have believed my 21-year-old self at that time. But what I can say is that I am grateful for the resources we have. I am grateful for people like Ifran and all of you on the phone today. But it is hard getting that support once they become adults. It's so difficult. Often the resources aren't there, or they lack the needs that your loved one needs. Sometimes you know more than the professionals, and they don't like to hear that. That's a tough one, right? When you know more and you're just as educated, you take the time to educate yourself. That's not always well received either. So I've tried to condense 34 years of a circle of life here into, where am I on my timer? 13 minutes. I want to say thank you for having me. I will always speak when asked. So if Ron or anyone on the phone, I can speak on many platforms in this arena. But if there's one thing I can do to help another family, that's really important to me as a parent. So thank you. And I really appreciate the opportunity, Ifran and Kristen, for having me. And I'm going to let you get on to the next person to the agenda, but thank you.
Thank you, Jackie. Thank you so much. Thank you for being so open and for sharing your life experience, right? I mean, that's the beauty of this community, special needs community, right? I mean, we are so closely bonded and we lean on each other, right? For example, I mean, there is no other organic acidemia case in the state of Delaware, right? At least not that we know of, the diagnosis that my kids have. And I lean more on parents all over the world, right? Thanks to technology now. I talk to a parent in Minnesota almost on a daily basis, on a weekly basis, if not daily basis, right? So I think it's very important that we lean on one another. I think you really hit a great point, Jackie, right? I mean, as parents, special needs parents, the line is blurred. You don't know when you graduated from just being a parent to being a caregiver. And there's no end in sight, right? Like right now, my oldest is 19, and we spend sleepless nights thinking about the transition to adult care, right? So it's like, so it's like, I mean, not a single day goes by where we don't have to deal with new issues. So, okay, again, thank you very much, Jackie. So with that, let's move on to our next speaker. We'll hear from our own state rep, Paul Bambach. Paul Bambach represents the 23rd district and has been a great supporter of the special needs community and the rare disease community in specific. As I mentioned earlier, he, along with Senator Poore, co-sponsored the RDD resolution this year again, and he has been doing it for the last many years. I lost track of how many years he has been doing that. And he has also co-chaired several task force on education and on healthcare. So again, he's just a phone call away. So he's a great resource that we all depend on. With that, Rep. Paul Bambach, the floor is yours.
Thank you, Irfan. Thank you, Kristen. Thank you, Jackie. Thank you, Lieutenant Governor. And I'm going to be speaking about the senator, sort of setting her up. Jackie, when you were speaking, I'm not sure if you were watching, but I could see Senator Poore's head just nodding yes, because you have such shared experiences. And that's one of the beauties of our legislature, is we have members who really get it. You know, some of us have it in our heads, and because of the work of organizations like NORD, we learn what the issues are. But when you've lived it, it is just ingrained in your heart. And we have a few members, and Senator Poore is indeed one of those who has lived this so personally And that makes it so much easier for the rest of us to lend that support. And when we come into the legislature, we come from all different backgrounds. We don't have all the experiences of people in our state. And I checked when you were speaking earlier, Jackie, you emailed me 4 years ago about another piece of legislation. And you did that because you're a Delawarean, and you did that because the Delaware legislature, we want to hear from you. And so this organization, especially if you have this advisory parent, caregiver advisory council, that will help focus the efforts of NORD to help the legislature better understand not just the Senator Poor who gets it, it's in her DNA at this point, but all of us, so that we can be much more effective. I often say I was a nerd in school. So when I heard report card, I immediately jumped to it. And then I immediately looked at, well, how's the student, to my left and my right? How's New Jersey, Pennsylvania, and Maryland doing? And we have an A, B, C, D, and we're not the D, but we're not the A, and we're not the B. And that's something that I really want to see us rise from. And I think, we've got our neighbors with good examples of how to get there. But I will say with confidence that the best way for us to move up is to have a focused advocacy group that can, not 1 or 2 days a year, but really regularly have that dialogue and let us know what we need to be doing to help advance that, to make sure the prescription drug, the out-of-pocket costs for the families are so much more affordable. And then the nutrition, and I'm sorry, I had to peek, went the second C grade, because again, I'm very focused on that. But the nutrition, when the website, which is terrific, and it talks about, for many of these rare diseases, certain nutrition can trigger bad situations, and that's preventable. But supports need to happen there, and we need to make sure there's awareness in our schools and our facilities. So there's so much that we need to do, but we depend on you. We depend on your help to help us understand what remains to be done to help your lives. We are, as legislators, we are certainly not experts, but we need to depend on your expertise, and we need to partner with you. We need to find out who our strongest people in each area are, and you're going to be very fortunate to hear from Senator Poor shortly, and in order to help us know how to get to that path as swiftly as possible. And I know in some cases it's painful to share your experiences and your life journeys, but indeed, I can't tell you how helpful it is. And it helps us work harder and not take no for an answer occasionally, but keep pushing so that we can get the policies we need to help your families in our state. So I'm going to end there. I think it was much more important that Jackie had the time to really share her incredible life journey. And I want to say, I'm here to use my ears more than my mouth. So I'll put my email in there. If you have other things you wish to share, please don't hesitate to reach out to me. Thank you very much, Irfan, again, for your leadership. You were the first one who raised this issue with me. So I'm now, 5% aware of the full rare disease issues. But I thank you for helping me begin my journey.
Thank you very much, Rep. Bomback. I mean, again, I have to say that, you have always shown willingness to support this community. And as a matter of fact, in all honesty, in all transparency, right, I don't even belong to his district, right? But he's the one who I go to, right, whenever I had to deal with any kind of legislation. So again, thank you for your support, and we are so humbled to have one of you as our leaders here. Again, thank you very much. Okay, with that, I will now introduce our next patient and also a caregiver, Zunaira Masood Johnwell. Zunaira Masood Johnwell is a passionate attorney by day and a devoted mother by night. She has been battling a rare genetic blood disorder since birth called beta thalassemia major. After overcoming so many odds, she hopes to empower others in raising awareness about rare diseases, advocate for our needs to doctors, hospitals, communities, and legislatures at large, and be a part of creating a culture of inclusivity and diversity for those differently abled. With that, Zunaira.
Thank you, Brother Irfan, and peace to everybody that is here. Thank you so much for having me today. Honestly, hearing everybody who's spoken thus far, I'm still processing and I'm at a loss for words myself. And being a patient myself, as well as a caregiver, it's very difficult to separate the two titles because patients themselves are caregivers of themselves. And personally, I do have a little brother who has cerebral palsy, and I do manage a lot of his care. But for the sake of avoiding to be redundant, I'm going to try to focus on myself, which is very difficult for me to do in light of the advocacy work that I do for others. As Brother Irfan had stated, I am an attorney, and I'm also an individual who suffers from something called beta thalassemia major. I was actually born with the condition, but I was diagnosed at 9 months old, and I was diagnosed here in Delaware in the very early 90s, and nobody really knew about it at all at that time. There was no treatment, pharmaceuticals, or anything to help the survival rate for people with thalassemia. And I was transferred to AI, but AI at that time also had no idea how to treat my condition. And they then forwarded me to CHOP. And that's where, for in large part, my entire life, all the way up till I was about 25, I was receiving full-time care. Beta thalassemia major is essentially a blood disorder where my body does not make blood at all. So we have a joke within the Thal community that we're vampires, because every couple weeks we're going to get our refuel, and we really do survive off of donor blood. And so anytime there's blood shortages, it's definitely scary for people like us, because our survival is very much dependent on transfusions. Every 14 days, I get 2 units of blood, and in between those times, I infuse 5 to 7 days a week over 10-hour periods with a medication that pulls out all the excess iron that we're getting from the voluminous amounts of blood that we do get every couple weeks. I am a proud mother of a 2-year-old, and I'm expecting another daughter in a couple of months. So individuals like us who do venture into parenthood, our treatment gets a little bit more difficult throughout the process. And right now I'm actually going every week for blood transfusions, and every week I'm getting 2 units of blood to help this vampirus create another life to bring into this world. The one major issue I did want to address today for this very important panel that we're having as a patient is what Jackie also touched upon about transitory or transition care for individuals who had the ability to go through the pediatric treatment programs that are very much well established, and the treatments are great. The doctors and the hospitals genuinely do have a lot of care involved in how they treat the children. But once we become adults, the advocacy drops because our parents are no longer there. We are pressured into clinical trials, treatments. We lose our health insurance. We are being thrust into adulthood as a normal person, transitioning from school to college to work life. And that was one of the most difficult, if not currently still, one of the most difficult issues that I have to battle. And I know many other patients transitioning into adulthood are dealing with. It was something I was very concerned about when I was in high school, with respect to how am I going to manage a full-time job, let alone even get a job with this condition? How do I address it with employers? Will I be able to maintain my Medicaid eligibility? One blood transfusion costs upwards of $10,000. And so if you could do the math with how many times every week or every month that I do get blood transfusions, that adds up outside of the pharmaceutical care that I get through my infusion therapies. So one thing I really want the legislators to look into is transition care for patients with who are transitioning into adulthood. There's a very huge gap and missing link with assisting patients going through this transition, going to college, being able to study abroad, establishing themselves with a job and a meaningful lifestyle and income. I feel like those sort of issues have been put on the back burner, and I feel a lot of other people on this panel and those who are in attendance and who will be listening to this in the future can really connect with. And I am more than happy to be able to speak with legislators about my personal experiences leading up to where I am at today, and continued advocacy in this manner, particularly during COVID. And I would transition to my little brother's care, who has cerebral palsy. He's been bedbound for over 2 years now because of COVID. Centers that help with adult day programs with individuals with cerebral palsy or other developmental delays, they have been bound at home, and caregivers have been incredibly overwhelmed with trying to manage their care and continuing to survive off of an income or a lack thereof, and supporting their children or their loved ones through this process. And that has been one of my biggest goals in the last couple months, is to try to get my brother back into a day program. And there's not enough. These day programs are struggling. It's an understatement how much they're struggling for hiring people to take employees rather, to take these positions to help in assisting in their care and continuing the way we did pre-pandemic. My little brother is also an adult, so a lot of the advocacy is being done through my parents and myself as his guardians. But it's definitely been a very difficult process. I didn't expect to make it this far with my medical condition. My parents were told that they would not see me walk across the stage in high school, but I did graduate high school, I did graduate college, I did graduate law school, and I am a mother now. So our outlook in life is progressive. We are transitioning into phases of life that people with thalassemia and other rare diseases never imagined seeing or even expecting to live to see. So our legislation, our medical industry sort of needs to catch up to one another. And I think there's that missing gap there. But I hope that those who are listening can see that patients living this life, we try to keep our smile on, but it's a full-time job more so than our actual full-time job is. And we're trying to assimilate into a able-bodied society that doesn't necessarily accept us. For me, being someone who doesn't have a visible physical disability, that's been a struggle as well, to be able to advocate for myself and advocate for my so-called deficiencies in certain capacities, to be able to get accommodations. All of these things have been incredibly difficult, and all of these things need to be addressed one after the other in order to create a more inclusive Delaware, an inclusive United States, and overall society. But I don't know how else to say that our advocacy hasn't been lacking, but I don't think it's been being met with the same care. But hearing the legislators here today, it's really been humbling, to say the least. I'm very, very, very pleased to see the work that's being done. And honestly, Brother Irfan and now Jackie, who I've now been introduced to, it's very difficult to speak with you guys on this panel with respect to the challenges that you guys have faced. But I, as a patient, as well as a caregiver, am here to support you guys, as well as our legislature, as well as NORD, in moving forward and hoping to create a path to better patient advocacy. Thank you so much.
Thank you so much, Zunira, for your inspiring journey. And I have to say, Zunira's family, they have been a source of inspiration for all of us, right? Especially, I've seen her grow. We have been living in Delaware for the last 20 years now, and I've seen her family very closely. and she's a source of inspiration. We tell our kids, she's your role model, guys, right? And they just put things into context, right? You're dealing with parents who I'm sorry, who question the life expectancy of their kids, right? And then you see this one person who's thriving despite all the challenges. I mean, that's a huge, it's like, this is what we call breaking the glass ceiling, right? So anyway, thank you, Zunira. Thank you for sharing your story. And and actually, some of you might have met her. I think back it was 2018 when we used to do this in-person event, right, at the house. Zunira's parents and her younger brother, little brother, was there. I'm sure Senator Poore and Paul Bamback, and also Lieutenant Governor. I think you have a picture with them as well. So anyway, thank you for sharing your story. Now, last but not least, I would like to invite Senator Nicole Poore. She represents the 12th district and has been a tireless advocate and champion for special needs community. She also brings the unique perspective of being a caregiver and parent to a special needs child. Her son Nicholas is diagnosed with cerebral palsy. And to put simply, she continues to be our voice for healthcare, education, and other needs of special needs community. In all honesty, I mean, whenever I reach out to her with any ask, I feel this tinge of guiltiness in me, right? I'm like, here she is dealing with her own challenges. Despite that, she's willing to put herself front and center to champion our cause. With that, Senator Nicole.
Good afternoon, everyone. That was such a nice opening. Thank you very much. But I would be neglectful if I didn't say that, I am here because of the same reasons why you're here. What I do know is that 1 in 10 people in the United States are affected by one of the 7,000 diseases and conditions considered rare. Each of them have faced greater challenges than ever before because of the pandemic. And so it's not easy to describe to people what the last 2 years have been like. It's really cool to be able to go on Facebook and post pictures of smiles to, sadly enough, watch our people in our state and across the nation tear each other down. And when I first entered into the social media arena, I found such joy in it. I found the desire to be able to find old friends, family members that I had not connected with in such a long time. And they used to call me the selfie senator, and I enjoyed it. But as I saw the world changing, as I saw the sadness overcome each one of our families, and then to be trapped in our own homes during one of the toughest times was very, very difficult. To watch the lack of services disappear, slip right through your hands. For us, I will tell you that my son had transitioned from 21 to 22. So we had lost every single bit of services that we had, let alone we had subjected our son to a surgery and went from a 5-week stay to a 4.5-month stay. So my challenges are no different than each and every one of yours. I absolutely cannot thank you enough for sharing your stories. I am so excited to hear, Mrs. Johnwell, that you are going to have a baby, that you're on your second baby. I need you to know that you can never believe someone telling you that your life is not worth it, or that there is a death date knocking on your door. There is a death date for every single one of us, but it is not left for someone to tell you your value in life. And along this long road and journey for my husband and for my family, we've grown stronger. Not many families can. It's very, very difficult. The burden of being the caregiver and not the mom or the dad changes overnight. As time goes on, and if you're fortunate enough to have other children like my husband and I were, we found very early on the discrepancies between, child 1 and child 2, and then child 3. Each one of them have brought different challenges, but also great successes to us. And so I just want to take just a second to describe this. So when we had my son, Nicholas, at the age of 28, we'd been married since we were 21. We had Nicholas, and I had gone into preterm labor, and I had spent a month upside down in what they call Trendelenburg. And I just literally talked about this on the Senate floor, which I had not shared ever, but I had to say to my colleagues, I did everything upside down that you do standing up. So take a moment and think about everything you do in the course of the day. I did upside down, all to protect the pregnancy, to go to great lengths to have our first child. Little did I know that 28 days after his delivery, that every day I would say to my husband, we're okay, we didn't get the blue screen. I watched families fall apart. I watched moms and dads and grandmoms and aunts and uncles cry when they got that blue screen. And every day we got through and didn't get the blue screen until day 28. And on day 28, when I watched the nurses crying, I thought, wow, someone's getting that blue screen. God, who is it going to be today? And then I saw the doctors walking towards us, and I knew it was our turn. We were not escaping the blue screen. And so what did that mean? We had no clue. We had no clue that day. We had no clue 15 months later until the diagnosis of cerebral palsy was given to my son. So, but you know what? God laughs at people who make plans, because within that period of time, we delivered our second baby. 3 months on bed rest at Christiana Care, lung surgery, for a one in a million chance that would ever happen. There was nothing actually in her lung. And so, but we made it through that surgery. And then 4 years later, we had another child. And so today my children are 23, 22, and 17. And so what I say to each and every one of you is that if I had listened way back when, after we had my first son, and they encouraged us not to have any more children, I would not have been blessed with 2 more children. And if I had listened to the doctors tell me that Nicholas's worth was not there, then we wouldn't be where we are today. And today, as you hear my dog barking, that is because my son is up in his walker and he's doing laps around my hallway right now, and wanting to talk to me. So I have my daughter shutting the door and letting the dog in and out. But this is how we live. This is our lives. And I wouldn't change any single second of it. And you know what? Some days for all of us, our days are really, really high. My glass is always half full, never half empty. I think as I get older, I get a little more sentimental, because I used to be proud of the fact that I never cried. And now I find myself getting choked up more and more, because you know why? I'm not alone in this. I have friends all across the nation, but I have friends in the state of Delaware who encourage me to actually be the voice, to continue to push forward, and to make sure that every single day that we make a difference, not just for me, but self-servingly for me, because I too struggle with whether my aide can show up. My aide is amazing, but she's getting ready to have a baby. And I'm not going to find another person like her who's going to love my son as much as I love him. And I don't know if I can find a day program, because you know why? There's not enough staff out there, because we don't pay them well enough. And we cannot find the resources to be able to do that. So I stand lockstep with each and every one of you in your daily battles. I promise I'm no different. The only difference is I report to Legislative Hall to make sure that I can make the effective changes to help us. And so to that point, I just want to touch base really quickly on the fact that, yes, every year I do help and promote the resolution for making sure that we recognize Rare Disease Day, but also that with Representative Kim Williams, myself, and Representative Paul Baumbach, and the Lieutenant Governor, and all of our colleagues, that we passed legislation for K-3 basic special education funding. And that last year, Representative Deb Heffernan, one of my strongest supporters in this world, because she too lives our life in repealing the subminimum wage. We recognize that, you know what, everybody is of value to make a dollar, and we should not shortchange somebody because of their disability. And then lastly, working with Christiana Care, wanting to make sure that we worked on a non-acute patient medical guardianship task force. It was by far, what I can tell you, probably one of the most rewarding task forces I've ever participated in. And you want to know why? My first statement to everyone is, I can rewrite any type of legislation and disrupt your whole plan of business. Or we can sit here like adults, we can debate, we can agree, we can disagree, but we can find solutions for the people that need the acute care attention. And you know what? Out of that task force, I only needed to put out 3 pieces of legislation, and most of it was regarding funding, because they found their own solutions by sitting around that table. So I'm not sure if I went over my time, so I apologize if I did. But I need to applaud each and every one of you, one, for sharing your story, because I know how personal it is. And you know what? We don't let people inside our world, because you know why? We say, hey, if you don't have to live this world, congratulations, good for you. Because in your lifetime, we'll all have challenges. But if you really want to know what it's like to have to shave my son's face, or change his diaper multiple times during the course of the day, or make sure that I'm cleaning him up so he's not drooling down the front of his shirt, I'd be happy to share all that. But I'm not sure that it would be as effective as if you saw it or you had to do it every single day. So thank you. And thank you for having me.
Thank you very much, Senator Nicole Poor. I mean, what an inspiring story, right? I mean, we all talk about how we wear dual hats or multiple hats. I think none of us can match your rigor, right, in what you do despite your own personal challenges. Again, thank you for that. Thank you for doing what you do. So again, I think as Kristen was sharing that the scorecard for the state of Delaware, I think we have some pockets of excellence, and we have some areas where we need improvement. But just looking at the panelists here, between Lieutenant Governor and Senator Nicole Poor and Rep. Baumbach, we know that we have people who get this, right? I mean, that's a big win for our state of Delaware. We have people who get this, folks. I think we have done a great job of sending the right people to the House. That's so awesome. I think one thing I want to touch upon, right? The vulnerability of the special needs community, of the rare disease community, right? I recall vividly. I gave an interview a couple of years ago, and they were talking about, so Mr. Patel, what is the one thing that keeps you awake at night, right? Apart from the challenges when it comes to expectancy, life expectancy and all, what is the one thing that keeps you awake at night? So I answered them, the one thing that keeps me awake at night is 2 of my kids who went through life-saving organ transplant. They're so dependent on those medications, right? Not a day goes by. They can't skip the medication, even a single day, right? Or single dose. So I said, I worry, what if there is a war or something and the manufacturer stops manufacturing those medications? And the guy was looking at me, he was like, what are you talking? You're talking about war in 21st century? I'm like, folks, it's so surreal. Last week, I got an email in our organic acidemia support group, a parent in Ukraine asking for help because they belong to the same medical community that we belong to with the OA, and they were struggling to get the medication for the kids. I mean, things that don't impact normal common people, right? The normal people. These are things this community has to go through. And again, to simplify things, like Senator Poor said, right? We always look at, live our life. We take life one day at a time, right? So I recall I had a meeting with the school administration for my son who went through some challenges, right? And then we're coming up with a schooling model. He goes to Newark Charter. We're coming up with some schooling model, and then obviously as parents we're advocating for this and that. And then the principal, in all fairness, he asked, so Mr. Patel, what do you want at the end of the day for your son? Folks, you know what I said? I said, I want him to be happy. Right? It's as simple as that. I just want him to be happy. So what I'm saying is, you know what others take for granted comes hard for this community. So again, thank you so much. Thank you very much for all of your time. And again, Senator Poore, I had to come back to you on this again. You just had your dental surgery this morning, and your willingness to participate. I mean, that speaks volume on your commitment, right? And I had to say, you look much sharper than I do today, right? I mean,
Well, I hope I can see that I'm still swollen on one side. So I have to laugh because I thought, oh goodness, I hope I'm not slurring my words.
Yeah, no, you're good. Yeah. Again, thank you very much. So again, we will, Lieutenant Governor, we will come back to you and your staff, right, on the task force for the RDAC. And again, thank you, Jackie, and thank you, Zunira, for sharing your journey with us. Again, like I said, I mean, alone we are rare, together we are strong, right? Again, thanks a lot. So Kristen, any closing comments from your end?
I just would like to thank once again all of our speakers today. It's incredible to see everybody come together today and, hear the stories and hear the support that we're getting from, the legislation in Delaware, and we appreciate it. And I know I can speak on behalf of NORD when I say we are looking forward to continuing these conversations throughout the year and to improve the quality of life of patients and their families in Delaware. So we thank you all for joining us today. This call was recorded and it will be available on the rarede.org website later next week. So thank you. And thank you again, Irfan, for hosting and all the work you put in towards this. And thank you again to everybody joining us. Have a great weekend.
Yeah, thank you very much. Yeah, bye-bye.